This is Clubfoot. Okay, it's one of the cute little. I'll call her Sophie. A great little baby. What's the problem here? Otherwise healthy, otherwise fine, but take a good look at her feet, and this is classic bilateral clubfoot. Um, it's again the most common musculoskeletal birth defect in the world. Approximately 1 in every 750 live births, whether you're again a dirt farmer in Rwanda or a wealthy person in Las Vegas or wherever you might be, the roll of the dice says about 1 in 750 times you're going to have a child born with clubfoot. It's a random genetic thing that we don't really totally understand yet. Twice as common in males as females, and occurs in both feet about half of the time. Again, it's not just it's everywhere, and these are some examples of clubfoot. Kids from around the world, again, Mexico, India, China, you name it. There's really not much discrimination in terms of who turns up with this. And you see a couple examples here of what happens if it's not treated, or if you're destined to go through life with your feet turned down and in like this. And in fact, here's a couple examples. Two little guys. Rilwan on the left is 7 years old in Nigeria, and Octavia on the right is 10 years old in Brazil. And you can imagine, certainly in a developing country where walking is so important, you need to walk to school, you need to get water, you need to collect firewood, you need to do everything on your feet. If you're burdened with this kind of a deformity, you're subject to ridicule, your opportunities are severely limited, and the data shows you're likely to end up in an orphanage if you're lucky in some cultures, and certainly destined for a life of deprivation and not much chance for success. You can see what surgery amounts to, and that is, there's no question the surgeon can go into your foot and ankle in about an hour's time, straighten things out, put a few pins in, and make the outcome look like a foot. The problem is that in the process, when you lengthen things and shorten things and cut joint capsules and release ligaments and so on, you're in pretty bad shape later on in life. So the parents are happy after an hour of surgery that your foot looks normal. You're good when you're young and maybe a teenager. The data shows here by the time you're 20, you really start going downhill. You start to go downhill. And by the time you're in your 30s, your quality of life is equivalent to having Parkinson's disease or chronic heart disease. And I can tell you, we have somebody from Oskaloosa. I can tell you that last week I spent an hour talking with a young man who's 22 years old that just had both of his feet amputated because he couldn't no longer live with his two painful arthritic feet as a result of 4 surgeries when he was a youngster here in Iowa. So that's why you hear Herb be so passionate about surgery. It's not only costly, a waste of medical resources, it's a long-term detriment for the young kids that undergo it. Well, what do we do about it? Well, the alternative to surgery, of course, is Dr. Ponseti, who came here to the university in 1941. And by 1948, he had it all figured out. He figured out that he could do some serial casting, some sequential casting, and progressively straighten out the foot, just like we think about orthodontics. Okay, the orthodontist doesn't grab a pair of pliers and straighten your teeth or cut your gums and rearrange things. They very gradually let, as Dr. Ponseti would say, let nature do what nature wanted to do, and that is to grow a straight foot. So he had this figured out, but he spent decades convincing the medical community that it was a better way to go. Even though he published numerous scientific papers, everyone ignored him. And finally, in 1996, he wrote a comprehensive book on all of his research, and the internet arrived. And the parents on the internet started to realize that surgery was not the way to go, and that Dr. Ponseti had the real answer to fixing kids' feet. Here's what it looks like. Basically, you see a little 1 week, 10-day-old, 2-week-old infant, teeny little feet. You gently manipulate and stretch those as far as they will go into the normal posture. Apply a plaster cast, just like putting on braces on your teeth. Apply a plaster cast, wait about a week, stretch a little more, do it again, stretch a little more, and it doesn't take very long. In fact, it takes about 4 to 6 weeks, and you can take a foot like some of those that I showed you in the first couple pictures and turn them around. And this is just sort of a time lapse of 5 weeks of the same foot, and as they came out of the cast, this is what they look like. And at the end of 5 or 6 weeks, typically, there are some problem cases, but typically 5 to 6 weeks, and the foot looks like and functions like a normal foot. One of the nice things about this technique, when we talk about the global problem of clubfoot, is that you can do it anywhere. Because so far, what did I say you need to do it? A smart doctor who knows what they're doing, and some plaster. Okay, so it's not, you don't need an x-ray, you don't need an anesthesiologist, you don't need surgery, you don't need anything. It's non-invasive, and anybody can do it anywhere. The people you see here, top left is Mexico, the top right South Africa, the bottom is Gaboko, Nigeria, where all the bad guys are running around these days. So it's possible to do this just about anywhere. The second part of the treatment is really the parent's responsibility, and that is once the feet are corrected by the casting, the tendency, just like with your teeth, if the kids don't wear their retainers, the feet want to turn back in again. Okay? And principally at night, when they're resting and relaxed, the genetic code for this deformity is still there, and the feet want to go back again. So the kids need to sleep in a pair of shoes with a bar, like some examples you see here, to keep that from happening. And if you're really good, you can calm the kids and tell them they're sleepy shoes and all sorts of things. And the really successful parents, the kids don't know any different. They think when you go to sleep, you put shoes on, you know, and it works. And if you can do that until the kid is 3 or 4 years old, they're off to the races. During the day, they're doing everything any other kid does, as a 1-year-old, as a toddler, as a young child. It's just at night, they have to keep that recurrence from happening in terms of the feet getting curled up again. Bracing is a problem, because you can imagine if you have a 2-month-old infant, the feet are about yay big, right? And nobody makes really good shoes for feet that small. So you've got to hold the foot firmly, but you can't hold it too firmly because of tender skin and so on. So there's a challenge in coming up with a real good quality brace, particularly in developing countries where materials are hard to come by. Leather's not the greatest. You can't find silicone liners and things. So we have very good quality braces, one of which was developed by Dr. Ponseti here in Iowa, but it costs $400, $500, $600, and that's a year's salary in Rwanda or Zimbabwe or someplace. So that's a problem, and it's a problem around the world, because if they don't wear the braces, they get relapses, and if they wear poor braces, they get skin sores, and ultimately, in the middle of the night, the parents say, we can't do this anymore. The kid's crying all night because his foot's bleeding. Let's just give up, and then they're back in the clinic to start all over again. Okay, so what's it going to take to fulfill this vision of a world without clubfoot disability? In its simplest form, it's kind of 3 things. One is we need enough smart doctors who know how to do this, and it's more than just apply a cast. You can imagine with a teeny little foot, the actual manipulations are quite delicate and quite intricate. Dr. Ponseti used to say it's like playing the piano. You had to feel every bone with your fingers. So we need to train doctors, as Herb mentioned, and that's the key thing that we try to do at Ponseti International. We do need some good braces that are affordable in the developing countries if we're going to reach all these kids. And then we need support in a lot of the clinics and hospitals where this treatment's being applied. There's a need for simple things like cost of transportation. How do you get to the clinic since you have to come back every week? Things like food for the kids while they're waiting to be treated. Basic issues like awareness that clubfoot is treatable. Where do you go to get it fixed? In many cultures, people don't even seek treatment because they don't know it's available, or if they do, they have a cultural impediment to changing what it is that Allah or God or whoever decided their kids should live with. So there are a lot of cultural issues to be dealt with on the local level, as well as financial and logistical issues. Ponseti International, and I won't go into all the details, but this was a association recognized by the Board of Regents in 2006 at the University of Iowa. And for the last 10 years, we've been trying to train doctors, tried to build programs, develop clinical guidelines, work with orthopedic societies, conduct symposiums, mainly do a lot of training doctors to and healthcare people to support treatment of this program. And the training is a bit more than just, okay, let's give a 2-hour lecture about how to do this. It really requires hands-on training because it's a manual skill. It's like surgery. You wouldn't learn surgery by looking at a DVD, or at least I wouldn't want the surgeon working on me if they did that. You want someone who's trained to learn this manual skill and do it with great exactness. So it takes seeing 25 or 30 patients. It takes having a skilled mentor sort of look over your shoulder, just like the way you would learn to do surgery or any other intricate medical procedure. And then the Iowa Brace, about 4 years ago, we put together some of the smartest people we could find here at the university and said, can't we develop a low-cost, highly effective brace that we can get to these people in developing countries? And the result you see here is the Iowa Brace. In the process, we've formed a 501c3 called Clubfoot Solutions, now headquartered in Cedar Rapids. To produce what you see here is the Iowa Brace. Functionally, it's equivalent to the $400 or $500 brace that we see here in the U.S. We've made about 30,000 of these available now for the developing world at about $15 a piece. So by mass producing them in this China, okay, which nobody makes shoes in the U.S. anymore, but by mass producing these and shipping them in large quantities, we have 3,000 in Nigeria, 3,000 in South Africa, 3,000 in Pakistan, and they're being distributed to clinics in those countries. And again, that's sort of another story, but the university actually owns the patent on these braces, and they'll probably never make any money because it's a nonprofit, but they don't know that, so we won't tell them. As you've heard already, Rotarian Action Group is not a Rotary Action Group, it's a Rotarian Action Group. So it's a collection of Rotarians that have a common cause that get together and say, let's do something about this problem. You see the list here in terms of the different issues, in terms of blood donation, hearing loss, literacy, malaria, and all the different issues. And about 1.5 years ago, we went through the process to get recognition and approval by Rotary International for the Rag4clubfoot, Rotarian Action Group for Clubfoot, under the mantra of maternal and child health. This is the website. It's pretty simple, rag4clubfoot.org. I'll give you that again at the end here if you want to write it down and check it out. In the simplest form, as it says on the website, is the Rag4clubfoot is a global clearinghouse and a project facilitator. So the idea here is to be a matchmaker, to find clubs and districts that are interested in addressing this problem and help them join together, help them write grants for training purposes, help them do projects on the local level to see if they can support treatment, recognition, referral, and treatment of kids with clubfoot. So here's some of the things that we think Rotarians can do as related to and around the Rotarian Action Group. They can certainly, the RAG is certainly interested in recruiting Rotarians, so that's why we're waving the flag saying join up, be a member, help us out. Certainly support training for physicians. We need 4,000 physicians. The average doctor trained to treat clubfoot can treat about 50 kids a year. That's one new patient a week, and then they see them every couple of weeks for casting and such. So our 10 years of experience says 50 patients a year is a good number. So if you divide 200,000 kids by 50, you get 4,000 physicians. So we need 4,000 clinical sites around the world. We probably need another 1,000 because they're never going to be equally distributed, but we need at least that many to treat the kids that are born with clubfoot every year. We need to involve and assist families and caregivers. Again, as I mentioned, simple things like transportation, bus fare, the cost of plaster. In Nigeria, a roll of plaster costs $4. And I can tell you there are parents that come into the clinic and we say we need 2 rolls of plaster to put your cast on your kid's leg, and they'll say, I'll come back next week. Because they're going back to the village and talk to somebody, the church, the family elder, the village elders, or somebody to come back with the $8 to buy the plaster to put on their kid's foot. And that's the kind of thing that certainly Rotarians can help with. We know about braces, and we're working on using a lot of the networking of Rotarians to help get braces into the countries where they need to go. I mentioned a little bit about public awareness, the message, that simple message that Clubfoot is treatable. Putting up posters in dispensaries or pharmacies or gathering places in different countries just to show pictures of before and after treatment to get families to bring their kids to the clinics. And then again, refer to appropriate facilities. And then ultimately, as Herb was alluding to, in terms of the governments or insurance or whatever the system might be, to make the Ponseti treatment the standard, the routine treatment, just like if you have an ear infection, you get an antibiotic. If you have this, you get that. If you have clubfoot, you get Ponseti treatment. That's the goal in 10 years, that it's nothing special, and people forget that we ever did this. It's just part of the routine treatment that kids get everywhere. Let me give you an example. This is, I'm sure you've all been reading your Rotarian magazine, cover to cover, right? The one you just got? Everybody's read that? If you're reading it, you see in the World Roundup, they talk about projects, global projects in Malaysia, Argentina, US, Philippines, and number 5 is Nigeria. Interesting. What's going on in Nigeria with World Roundup? And I'm sure some of you may not be able to read this from where you're sitting, but there's some key features in this news item. That 3 clubs in Lagos, Nigeria, 3 Rotary clubs, got together, raised $13,000, and they're using that money to treat 210 indigent children, meaning children who wouldn't otherwise afford treatment, and they're being treated at the Lagos State University Hospital, in Nigeria. Great project. Exactly the kind of thing that as a RAG we would like to facilitate. Local clubs buying in to the need to treat the kids in their community. Well, that just didn't happen. This is Dr. You ready? Olayinka Adegbahingbe. He came to the University of Iowa here in 2007 to work with Dr. Ponseti to learn the Ponseti method for treatment. He stayed on and worked another week or two with Dr. Marquende, a member of our club, who's actually in surgery today or couldn't be here. 2009, Dr. Bill Whitmore, a retired orthopedic surgeon who studied under Dr. Ponseti, in 2009 spent his own $5,000 to bring himself and 4 other physicians to Nigeria to work with Dr. Adegbahingbe to train 8 more doctors. We got a little grant from the USAID a couple years later. Sorry to have me in the picture back there, but the person on the left is the Minister of Health of Nigeria. And we went with our program champions, these doctors that have been trained, and sold the Minister of Health on making the Ponseti method the standard of care in Nigeria. It took more than one visit to do the selling, I'll tell you that. What you see here on the right, the gentleman on the far right, the African gentleman, is a past district governor of Rotary, who happens to be a doctor and who happens to work in Lagos State University Hospital. And this is what the clinic looks like there. You see Dr. Olayinka, Dr. Adegbahingbe peeking in over the shoulder, but this is actually the clinic that was written up in the Rotarian magazine. So it takes a while to make this all happen. It takes a lot of politicking. It takes a lot of discussion. But lo and behold, the Rotary clubs now are stepping up and saying we can do this. So now each star you see on the map here is a clinic with a trained doctor who can deliver Ponseti method treatment to the kids in Nigeria. There are 8,000 kids born every year in Nigeria with clubfoot. And we probably need 120 clinics to do that. Right now, the latest count is about 60. And no more money coming into this. They're all doing training more and more doctors themselves with local resources. They're on a roll, and they're actually a model program for the rest of Africa. Let me show you one more example of another doctor that's part of the group there. Who's ever heard of Enugu, Nigeria? No? Somebody? Oh yeah, Jim has. Okay, Enugu is one of the states in Nigeria. It has a population equal to Iowa, about 3 million people, although it's 1/20th the size. You can imagine the density of the population. One of the doctors there is we'll call him Dr. Losh, that's what we call him, Dr. Losh, but he was one of these 8 people that Dr. Whitmore helped train back in 2009. He now runs a very active clinic in Enugu. And what do you think Rotary can do for Dr. Losh? Well, who knew in Enugu that there were 19 Rotary clubs within 50 miles of his clinic? So when he has indigent patients, just like the patients in Lagos, the logical place to go is to the Rotary clubs. So part of what the RAG is involved in is getting Dr. Losh invited to go speak to the Rotary clubs and have the Rotary club members come see Dr. Losh's clinic so that they can develop some chemistry in terms of how the Rotary clubs might be able to help out at the local level. And as I mentioned, the training is kind of the central to all this. You need to train physicians to make this all work. And we have a project ongoing with Rotary funding, much of it originating in this district in 5970, with a project ongoing in Brazil to train another 60 doctors. We have a project in Mexico that's just about to be resubmitted to Rotary International, and then we have the other countries you see here, projects in various stages of development to use some of the matching funds and the district designated funds that you all have contributed to help fund these projects. We've been engaged in, of course, the RAG is engaged in, again, spreading the word. This is the meeting in Brazil, Sao Paulo. Another thing that we've been involved in that Rotary's helped out with greatly is World Clubfoot Day, okay, June 3rd. And some of you have heard this story before, but June 3rd is Dr. Ponseti's birthday. And if you want to declare a World Day, you go to Wikipedia and you find a day that nobody else has declared, and you say, this is World Clubfoot Day. And it's probably one of the greatest things we ever did, because people all over the world are celebrating World Clubfoot Day, as you see from some of these pictures from Pakistan and India and Chile and other places. It just is taken off like a rocket. We have other projects locally. Laces for Braces is a project. You see the Cedar Rapids Colonels baseball players here with their colored shoelaces, as well as about 8 or 10 of the high schools and such in Cedar Rapids area raising money. We got the company to donate the braces, and the money that we take in helps us fundraise. This June 3rd here in Coralville, we're going to have a kids triathlon. This is a project that was started by a mother in Minneapolis a couple years ago, and she last year had 400 kids sign up and find sponsors. We're going to do the same thing in Coralville this June 3rd, and you'll hear more about it because we're going to solicit Rotarians to help us out. Let me show you, this is our buddy Rilwin. I showed you to start with, our little guy from Nigeria. You can see on the right what he looks like after 5 casts, even though he was 7 years old, treated by Dr. Degbahingbe. Not walking perfectly, but then he hasn't done a lot of walking in his first 7 years of his life. The outfit he's got on here is his school uniform, so he's going to school for the first time, because before that he was living with his grandmother. His father couldn't tolerate having a deformed male offspring in the house, so since shortly after birth he was living with grandma, but now he's doing a lot better, and I can report he's going to school. Walking to school, by the way. And this is Octavia from Brazil. He's 10 years old. It took about 7 casts to get his feet straightened around from what you see on the left to what you see on the right, and he probably saw the big smile on his face. He's pretty happy. And kind of changed his life dramatically. So again, what's it going to take to make this happen around the world? As we mentioned, train the doctors, and we think we've been at that mission now for 10 years with Ponseti International. High quality braces, we think we've got a handle on solving that problem with what's happening here in Clubfoot Solutions, and of course the Rag4clubfoot is anchored here. And I would reinforce the point, this is all Iowa stuff, okay? This is Dr. Ponseti developed a technique here in Iowa. We developed a brace here in Iowa, and now we have the headquarters of the Rag4clubfoot to promote this and really spread it worldwide. There are 2 million kids will be born with clubfoot in the next 10 years. Okay? And there's no reason any one of those kids should have to go through life like Rilwin did or Octavia did before the treatment came along. And we really view all of this as, quite honestly, Iowa's gift to the world. This is an Iowa-centric campaign and something that started here and we hope will grow around the world. Thanks.